Thank you, sir, and all those participants in this session, a nice session. So, good morning, good afternoon, and good evening. Welcome to 1589th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you and welcome back. Today we have with us Dr. DEEPTI Sharma, BHMS MD scholar. Topic is PICA and its research-based homeopathic approach. Definitely these types of cases are the strength of homeopathy, and we can with ease give some solace to the patients. So on behalf of IFPH and welcome Dr. DEEPTI, you can have the platform for the next 40 minutes. It's over to you. Please proceed.
Thank you so much, sir. Let me just share the screen.
Yes, please.
So, good evening, everyone. Before starting, I would like to thank Dr. Sahani, sir, and Dr. Manoj, sir, for giving me this platform. The topic for today is PICA and its research-based homeopathic approach. Well, before starting what PICA is, let us first know what it is categorized in, right? So, PICA is an eating disorder as in there are various eating disorders: anorexia nervosa, bulimia nervosa, rumination disorder, avoidant restrictive food disorder, and then comes PICA, which is the persistent eating of non-nutritive and non-food substances for over a period of more than or equal to 1 month. Okay, so basically there was previously only the inclusion of non-nutritive substances and not the non-food substances. So non-food substances is included because the non-nutritive substances may also include ice, soda, or starchy materials like starch from potato and rice, which are basically edible. But the non-food substances will not include such substances like it only includes paper, soap, plaster, charcoal, clay, wool, ashes, paint, and earth. It is taken from the Latin word for magpie, meaning a bird of uncontrolled hunger which can burst to almost everything. So it is taken from the word magpie, which is a bird uh, who eats anything when it is hungry. The eating behavior is inappropriate to the development level of the individual, which means that basically the infants and toddlers, means below 2 years of age, they eat and mouth everything they get. They are not able to discriminate between the edible things and the non-edible things. Thus, they mouth everything, and thus it is suggested that below the age of 2 years, the diagnosis of pica must not be given. Since it is an eating disorder, so DSM-5 criteria is used for the diagnosis. There are 4 points. The first point being persistent eating of non-nutritive, non-food substances over a period of at least 1 month, which I have already told in the definition part. The eating of non-nutritive, non-food substances is inappropriate to the developmental level of the individual. The eating behavior is not part of a culturally supported or socially normative practice. Means in some parts of the world, there is a cultural norm to eat pica substance uh, normally, like when they are pregnant and when the child is born, clay or earth is given to eat. It is a normal practice there, and it is a culturally supported practice. The diagnosis for pica can be given only when the behavior is not part of the culturally supported practice. If the eating behavior occurs in the context of another mental disorder, example intellectual disability, schizophrenia, autism spectrum disorder, or any other medical condition which also includes pregnancy, it is sufficient enough to warrant independent clinical attention. Means the diagnosis cannot be given if there is the presence of another mental disorder, and pica is only limited because again, for the person when he or she is mentally disabled, it is she may not be able to discriminate between the edible and non-edible substances, and thus the diagnosis for pica can only be given if the condition requires additional clinical attention. Why is pregnancy included? Because it is seen that In pregnancy, there might be some deficiency, especially the iron deficiency anemia is very common. And we learned in etiology part of the same that iron deficiency anemia is also a part and also is also an etiology for the diagnosis of pica, right? Next, there are various subtypes of pica. I have mainly focused on geophagia and plumbophagia because they are mainly found, they are widely found. Geophagia is the ingestion of sand and clay. There are various rubrics in the repertories, synthesis repertory, Murphy repertory, even in Kent repertory. There are various rubrics pertaining to geophagia. The rubrics contain lime, slate, pencil, earth, chalk, clay, etc. and desire for. And there are many medicines given in under it. Next is plumbophagia, which is ingestion of paint chips, lead, and pencil lead, and lignophagia, wood, bark, twigs. Since pencil contains a lead part and a wood part, so two terms have been given, plumbophagia and lignophagia. Plumbophagia is for lead part and lignophagia is for wooden part. However, in the repertory section, the rubric given is food, pencils, desire. Means a single rubric is given for pencil and a single remedy is given under it, which is Calcarea carbonica. The other subtypes are entomophagy, which is desire and ingestion of insects, and a single remedy is given against this, which is chocolate. Steatophagia is the desire and ingestion of ash, and three medicines are indicated: Calcarea carp, Silesia, and Tarantula hispanica. While in sapophagia, which is desire and ingestion of soap, single remedy again is given, Calcarea carbonica. In coniophagia, which is ingestion of dirt, Calcarea carb and Cicuta virosa may be given. In xylophagia, which is desire for eating paper, however, in some texts, it is also given that desire and ingestion of wood is also given the name xylophagia. However, a separate term is also given, lignophagia, but some people include xylophagia under the same. And two medicines are given under it, Leccan and Lecfel. There are various other substances whose rubrics were not there in the repertory. Acuphagia, which are the desire and ingestion of sharp objects. Cotropyrophagia, burnt matches. Coprophagia, human feces and animal dung. Ematophagia, which is a desire and ingestion of vomit. Foliophagia, leaves, grass, acorns, pine cones. Hyalophagia, desire and ingestion of glass. Lithophagia, rocks, gravel, pebbles. Metallophagia, metal objects, coins. Plasticophagia, desire and ingestion of plastic. Tobaccophagia, cigarette butts. Trichophagia, hair, and urophagia, urine. Means there are various terms and the suffix phagia is added after it to name it a subtype of pica. There are also various other things like charcoal, coal, clothes, rags, which are not given any term being the subtype of pica, but they are also categorized under the pica. So for these rubrics in which separate rubrics are not given, the particular rubric is not given, we may use these rubrics like pica as a particular rubric and desire for indigestible things. Okay. So pica as a particular rubric, as a diagnostic rubric, is given in only two repertories, which are Murphy repertory and Boric repertory. There are various medicines named under it, which I have showed in the PPT. Alumina, alumin, calcarea carb, calcarea phos, chelidonium, cicuta, conium, paramat, hipersulf, hyoscyamus, ignatia, natramune, nitric acid, nux vomica, osamum cank, soranum, silesia, sulfur, tarantula hispanica, to name some. Okay. Now, etiology. What is the etiology of it? There are various etiologies that are proposed, but these are not proved because a particular etiology cannot be managed to be proved, right? There may be psychological cause and physical ones too. The etiologies include nutritional deficiency, deficiency of iron, zinc, or calcium, low socioeconomic status, abuse and neglect of child, family disparity, certain mental disorders, learned behaviors, underlying biochemical disorder, and cultural and familial factors. There are two main etiologies that have been widely accepted are first the deficiency one. PICA, which may be a result of malnutrition or undernutrition or serious kind of starvation, may be related to deficiencies of minerals like iron, calcium, zinc, or phosphorus, or nutrients, vitamin C and D, thiamine, and niacin. It has been postulated that iron deficiency may prompt the ingestion of clay. On the other hand, geophagy may lead to iron deficiency as the minerals in soil can bind iron in the gastrointestinal tract, thereby reducing absorption of iron. In addition, pica may induce iron deficiency by replacing sources of iron in the diet. Mm, This, uh, this tells that pica may be caused by iron deficiency or pica may even cause iron deficiency. It goes both ways. Another theory which is widely accepted is neuropsychiatric theory. Uh, in this, several laboratory animals have been associated with abnormal eating behavior if they have brain lesions. So it is postulated that pica might be associated with certain patterns of brain disorders in humans. Addiction or addictive behavior has also been suggested as one of the possible explanations for pica behavior in some patients. Sometimes, due to decreased activity of dopamine system, pica is induced. It also causes decreased dopaminergic neurotransmission. Incidence of pica has also been linked to certain comorbid conditions like Klein-Levin syndrome, mental retardation, and schizophrenia. While in the presence of mental retardation, schizophrenia, the diagnosis of pica may be given only if the pica is uh, evident enough to give that diagnosis. The clinical features on the left side, I have enumerated various symptoms that are seen when pica is there. However, the clinical features and signs and symptoms, they are based on the fact what type of pica substances is ingested. So mainly constipation or diarrhea, chronic or acute, diffuse or focused abdominal pain is seen. Nausea, vomiting may be seen. Loss of appetite or anorexia may be seen. We generally see small white patches like appearance on either side of cheeks. We mainly attribute it to worm infestation, but in pica it might be seen. Easy fatigability and bezoar, which is intestinal obstruction, may be seen. The signs may include abdominal distension, pallor attributed to iron deficiency anemia, change in behavior pattern like changes in concentration habits, changes in school behavior may be seen. Other psychiatric disorders like ASD, intellectual disability, and schizophrenia may be seen. There might be also spooning and thinning of nail known as kylonochia, and this may be attributed to riboflavin deficiency. Small elevations or papillae on the child tongue may be flattened and he may have superficial erosion. Because the habit of chewing the pica substance may cause the erosion of the papillae, and thus the child tongue may appear flattened. There might also be the lead line at the junction of the gums and teeth, which may be attributed to lead poisoning suggest. So in the junction, there is a line, a blue colored line may be seen, and this is the lead line. The child or the person suffering from pica may appear malnourished and have a history of weight loss. So there may be some investigations if the patient do not admit it verbally that there is pica, that he or she is eating such and such substances, then uh, there might be need of some tests to be administered like CBC, abdominal radiograph, USG, blood lead level, etc. In CBC, we may see for iron deficiency and for eosinophilia, uh, attributing to some infection. Abdominal radiographs might show Rapunzel syndrome that I have also mentioned here. The Rapunzel syndrome is refers to the continuous of trichobizar tail-shaped extension over the duodenum and jejunum. So the ingestion of hair may particularly cause bezoar, may particularly cause intestinal obstruction, leading to the obstruction of the intestine, and there may be tail-shaped extension, and it may appear like the hair of that fairy tale. There is Rapunzel now, so Rapunzel syndrome is given the name according to that. In the X-ray examination of bones, if the person is plumbophagic, means he or she is having desire and ingestion of lead-based substances, then X-ray examination of long bone may reveal an increased density at the metaphysis known as lead lines, which you may see in the X-ray here. The differential diagnosis. PICA is mainly the verbal acceptance of the person that he or she is having such and such substance for he or she is ingesting such and such substances. But various other differential diagnoses can be made. The first two are based on eating disorders. So anorexia nervosa, the patient might be eating the substances like these pica items like chalk or stones or pebbles or geophagia he might be having. And he might be doing this just to control his or her hunger. So in such cases, additional diagnosis of pica may be given, and main diagnosis will be anorexia nervosa. Yes, I would like to add that additional diagnosis of pica may be given in cases of eating disorders. Allotriophagy, allotriophagy and pica means same. They are used interchangeably also. But allotriophagy is where the consuming of non-food items is acceptable socially. It is called.
Dr. Deepti, please continue.
Am I audible now?
Yes, yes, please. Don't worry. Yeah.
I'm sorry. Yeah.
Okay.
Just a second.
Don't worry. Cool. So often happens. This we are continuing for this for the last 1,589 days, and we are facing a lot of occasions like that. So there is nothing worry. Don't worry.
Yeah, sir.
Yes, there's a first slide is there.
Okay, and just a second, sir.
Yes. No slide, 10th slide. Oh, yes.
Yeah.
Yeah, good. Okay.
Okay.
Yeah.
So, onychophagia, which is the chronic biting of nail pate, nail fore, nail pad, or cuticle. Cheek biting describes the simple act of biting one's own buccal mucosa, a particularly vigorous form of cheek biting in which pieces are torn from the mucosa is called morsicato baccarum. So, onychophagia include the nail biting also and the cheek biting also, and it is not included in the diagnosis of pica. It is obsessive compulsive disorder, while pica is an eating disorder. Next is excoriation or skin picking disorder, which is also known as dermatodexia, in which the human bite their own skin, like picking of lips, or that spanarium, picking of nail bed. It is included in excoriation or skin picking disorder, which is also known as dermatodexia. And dermatophagia, if
they ingest it. Now, the nutritional deficiency disorder, which are the differential diagnosis, which come under differential diagnosis, are hapticophagia. Hapticophagia is also known as tactile chewing cravings, and they are in the form of they are a phenomena observed in iron deficiency anemia, in which the person particularly craves to chew some form of hard substances that give them pleasure. Hard items to reveal the neurocognitive effects of deficient dopamine and excessive monoamine oxidase, and gets corrected with iron repletion. The person may crave for variety of items, including ginseng, pickles, sawdust, chips, popcorn, crackers, chewing gum, dry oats, etc. So, in this type of disorder, it is mainly needed that to know that the person really wants to eat a non food substances, or it is just because of the craving to choose some hard item. Desiderosmia, you might be noticing that I am always saying desire and ingestion of a particular non-food item, but desiderosmia is just smelling particular non-food item or smelling odors which are related to iron deficiency anemia. You might have notice that some people desire to sniff petrol smell, some people desire to sniff mud smell when it is wet. That comes under desiderosmia, and this is a nutritional deficiency disorder and mainly attributed to iron deficiency. Other differential diagnoses may uh, take factitious disorder, which is for fabricating illness. To in order to fabricate the illness, the person deliberately consumes some non-food items. Then he'll complain of abdominal pain or something like that, and particularly if they injure themselves, then it come under non-suicidal self-injury and non-suicidal self-injury behavior, which comes under personality disorder. But if they deliberately ingest something just in order to fabricate physical complaint, then it comes under factitious disorder. These all are basically apart from nutritional deficiency disorders, these all are basically the disorders pertaining to mind and are classified in DSM-5. Now comes the homeopathic part. Homeopathic treatment includes, there are various remedies, as I have already told in the rubric part, that according to subtype, according to the substances ingested, there are many medicines that are indicated in particular things. So, some of them are alumina, in which there is abnormal craving for chalk, charcoal, dry fruit, or tree grounds. In calcarea carb, craving for indigestible things is there, which is chalk, charcoal, coal, pencils, and also for eggs, salts, and sweets. In cicuta verosa, there is desire for unnatural things like coal. There is indigestion with insensibility, frothing at mouth. Cyclamen europeum is used for desire of lemonade and inedible things. The person craves sardines. Ignatia amara longs for great variety of indigestible articles, craving for acid things, aversion to ordinary diet. Lackfell, no appetite, great desire to eat paper. Nitric acid, longing for indigestible things, mainly chalk and earth. Tarantula hispanica, craving for sand or raw food. In belladonna, there is craving for undigestible things, and there is distaste for acid, coffee, and beer. In Nux vomica, patient crave charcoal, pepper, and chalk. Basically, we have heard only of alumina and calcarea carb, and also of sulfur, because the pica is mainly soric and syphilitic and also tubercular. So we have learned only about calcarea, alumina, and sulfur. But there are many medicines, and if we look into the repertory part, there are various medicines that are indicated for it. Now, according to the miasmatic viewpoint, firstly, I would like to implement that the Kantian method. says that the desires and aversions in the after the mental symptoms, the physical genres, the desire and aversion comes just after the sexual perversion. Means it's the second number in the evaluation of symptoms. It comes in the second number, desires and aversions. So if there is a desire to eat indigestible things, it is important symptom, and there is even a repertory for desires and aversion by Dr. Guernsey. So in the miasmatic viewpoint in H.A. Roberts, he firstly tells about the importance of cravings and longings, and they are the basic phenomena of great therapeutic value. In the chapter on Sora, he describes that Sora person are always hungry, and they long for many things, and they crave indigestible things, especially in fever. And in the syphilis chapter, in the chapter where he writes about syphilis, he also writes about the tubercular miasm, in which there is Sora and syphilis together. In these dyscrasias, he has mentioned there is a craving of indigestible things. However, if we look into the repertory part, in the Dr. Patel's repertory, in which he has emphasized on the miasm, he says that the craving for indigestible things is mainly because of Sora or syphilitic backgrounds. So now the research-based approach to PICA, because it is it is mainly something which cannot be objectified, which cannot be told on the basis whether it is increasing or decreasing, or what is happening in that. None of the lab report will show that pica is increasing or decreasing, because there is no particular investigation pertaining to that. So there are various scales and scores to objectify what is there in pica, whether it is improving, whether the diagnosis is increasing or decreasing, the severity is increasing or decreasing. So basically there are many scales and scores which are for eating disorders, but for pica mainly are the pica ARFID and rumination disorder interview, which short form is PARD, and it can be used for age 2 years and above, and it confers to diagnosis and severity management of pica. Second is DISC4, which can be used for ages 6 to 17 years, and it only confers to diagnosis. The eating disorder assessment for DSM-5 and structured clinical interview for DSM-5 can be used in adults only and confers to diagnosis only. The eating disturbances in youth questionnaire can be used for age 8 to 13 years and measures severity. The screening tool for feeding problems, which is STEP, can be used by parents only and measures severity. So there are various scales and scores, and all these some of these measures diagnosis and some of these measures severity. Now, the evidences from researches about the baseline characteristics. So, pica is predominantly found in preschooler, which is 3 to 6 year olds, and pregnant female. In pregnant female, we will give diagnosis only when it is severe enough. In majority of females, pica is found in comparison to males. People in low and middle socioeconomic strata are more prone to pica. There are mixed evidences showing bottle-fed infants and are more prone to developing pica after growing up. Dietary habit, which is vegetarian or non-vegetarian, and family history have limited relation with development of pica behavior. Geophagy, which is eating of earth, mud, and pieces of earthen potter, is reported to be the commonest form of pica, followed by eating of wall plaster, coal, and chalk or slate pencil. So most common is geophagy, as I have already told you. Now I have only found one homeopathic research pertaining to pica, and more and more research studies are needed for pica, because only one was found online. So study of cases of pica by using boric clinical repertory, and this study was conducted in Ludhiana, Punjab by Dr. Neha Panchal. It was an explorative study, and in this study, it was found an assessment and reassessment were done on CGI scale, which is Clinical Global Impression Scale, and it measures the severity. It is not particularly related to the eating disorders. It is not particularly related to pica, but it is a widely used scale to know the improvement status of the researchers. Okay, so um, in the things which cannot be objectified, CGI scale is mostly used. So in each case of followed up at an interval of 7 to 30 days, and assessment and reassessment were done on symptomatic improvement. Results were compared through CGI scale and severe at baseline and after the treatment. Data of sample size 50 was statistically analyzed to show 95% confidence limit. T-test was done to show the efficacy in post-test results. So the disease was seen more common in low and medium socioeconomic status and rarely in high socioeconomic status. Because of she says that because of unhygienic and unhealthy practices in lower socioeconomic status families, it is most pertinently seen in low and medium socioeconomic status. CGI-S score taken during the first visit was 4 in majority of patient, and CGI improvement score used to assess the result was found to be 1 and 2, very much improved and much improved in most of the patient. The most frequently indicated remedies were calcarea carb, alumina, ignatia, and nitric acid. You may see in the graphs that CGI severity score previously was moderate, mainly came under the moderate category, and improvement score were very much and much improved, mainly these. And the frequently indicated remedies, alumina, calcarea carb, ignatia, and nitric acid were there. So, in conclusion, there is a paucity of researchers in homeopathy in cases of pica, and many cases of pica go undiagnosed because people neglect pica behavior even in clinical settings. Even in the clinics, it is mainly unattended or looked down upon because patients suffering with pica are mainly objectified. Ki, why do you eat those? Because none of the etiologies are proved. There have been many studies in cases of pica in pregnant ladies and toddlers, but the domain of pica is not limited to these two groups only. Evidences from the literature shows that pica is a known entity in homeopathy, which is also demonstrated by ample of rubrics for the same, and thus researchers in homeopathy are warranted to know the effect of homeopathic remedies in cases of pica. Any questions?
Yes, thank you, Dr. DEEPTI Sharma. You are invited to an important, interesting, and scopeful section of disease disorders, especially for homeopathy. It's time for discussion. Those who would like to participate, please raise your hand. You can ask some questions or you can give some additions or some inputs. Then you mentioned about the cases, about around 75% of cases are geophagy. Then there's a most important thing, and also there's some diagnostic techniques, diagnostic criteria. That's also very interesting, especially children above the age of 2, isn't it?
Yes,
Otherwise,
yes.
yes. Okay. Then another interesting thing we must remember is that even though there are a lot of etiology, some deficiencies are there, so many conditions are there. Without all these conditions, we can produce such pica artificially with our medicines. What does it mean?
Sir, can you please repeat your question?
Yes, yes. You said about the etiology of this pica. So many
Yes, sir.
etiologies are there. But without all these etiologies, these conditions can be artificially created with our medicine. In
Yes, sir, definitely.
yes. So what is the meaning of that? Only these are representing up to a certain extent. Facts. But homeopathy medicine without all these conditions can produce similar symptoms. Am I right?
Yes, sir.
That is the positive side of homeopathy. Dr. Gurugaran, are you there? One of talented young physicians of this platform, Dr. Gurugaran. What is your comment?
About?
I think he is not there. Now there's a question in the chat box.
Okay, sir. Let me just see.
Yes. Single rubric calcareous carbonic is given which repertory? Yes. Dr. Deepti.
Yes, sir. Just a second. I'm
Okay.
stopping the share.
Yes, yes.
Mm. Check.
The question is the single rubric calcareous
Very
carbonic. Yes, sir.
single rubric for calcarea carb. So there are many rubrics in which only calcarea carb is given. Mainly the rubric for desire for pica item in pencil was given. Single rubric was given in that. Let me show you the slide. So soap desire, only calcarea carb is given in that, and in dirt desire calcarea carb and secuta verosa is given, and also for pencils desire calcarea carb is given. Only calcarea carb is indicated against it.
What about I think there is a bit expansion is needed in case of the miasmatic background, such cases. Just mention briefly about that.
Yes. So in H.A. Roberts' philosophy, the miasmatic background of pica is given as soric and tubercular, which is sora plus syphilis. And while in Dr. Patel's repertory on miasm, it is given that the pica is mainly attributed to sora and syphilitic background.
Another question, eating of nails.
So eating of nails is mainly onychophagia and it is not related to pica in any form. So eating of nails is comes under obsessive compulsive disorders and not under eating disorders. It is a completely different phenomena than pica.
Any medicine? It is a question. I think Medornum is one of the leading medicine for eating nail biting.
Yes, sir.
Yes. Now, anyone would like to participate, please raise your hand. There are a lot of experienced physicians are there. Dr. Hariharan sir, what is your opinion? Are you there? Dr. Umesh Chandra, do you have any suggestions or additions? Yes, please unmute.
Is there any cases which are solved then present?
Yeah, there are many cases. I have actually done a dissertation on this. In my MD, my topic is pica only, and I have cured. My sample size was 40 cases, and out of that, approximately 80% cases were improved, and out of the 40 cases, within 2 months, 5 cases were completely cured. Means there was no symptoms of pica in my before and after.
Yes.
Okay.
It means
Yes.
out of 40, 32 cases were cured. Am I right?
Yes. Not cured, they were improved, and 5 cases were cured.
Okay.
Not cured. What happened? What was the obstacle there? You must think about that.
Sir, obstacle, there can be obstacle, but there can also when homeopathic medicines are acting, the obstacles are there were no additional things that were given. The homeopathic medicines were only given, not no auxiliary method was given. So I think mainly attributed to homeopathic, this was the cure was mainly attributed to homeopathic medicine because no auxiliary method was.
Yes, I think we must go through the aphorism 259 to 263. It mentions about the diet and regimen and the importance of such modifications in treating chronic cases, especially. What about your opinion on it? Did you kept on that diet and regimen?
Sir, for the patients, we didn't tell that you should means you should not take this or that. But obviously, according to the remedy, we have suggested that for this particular remedy, you should not have this and this things, or you should not do such and such things. Mainly doing mainly keeping out of sight such items like that.
Yes, anyway, it was strictly advised by Master Hahnemann, because even in proving these were observed. That is why Dr. Samuel Hahnemann always insisted this should be interdicted. Then moderation in everything is the ideal methodology. Dr. Ram Parvesh Shah. Yes, sir, please. You can unmute now. Yes, yes. Yeah.
Thank you, Dr. Manoj ji, and everyone. Namaskar. Congratulations, Dr. DEEPTI Sharma.
Thank you, sir.
Very nice presentation. Clear presentation. PICA is a very important subject. PICA decides, other thing decides according to treatment miasmity. Very good select remedy, PICA, calcareous, tuberculum, TC, soric and syphilitic remedy, and tuberculosis diathesis.
Yes.
PICA patient is the tuberculosis diathesis.
Yes, sir.
Very good, excellent session, peculiar session. Very, very thanks, Dr. DEEPTI Sharma. Thank you.
Okay. Now,
Thank you,
Dr.
sir.
Vikram Bihari. Yes, you can unmute now. Yes, please. I think everybody should actively participate this program. Otherwise, it will not be successful. Yes, Dr. Vikram Bihari, please unmute. They must first of all surpass the inhibition. Dr. Vikram, please unmute. Any technical problem? Yes, please.
बहुत अच्छा प्रोग्राम रहा सर आपका, और हम तो अभी कुछ देर पहले से ही सुन रहे थे, बीच में हम चले गए थे कॉल में थोड़ा, तो बहुत अच्छा लगा अभी सर.
Yes, thank you. Now, Dr. Pokrail. Doctor, I think it is North India very cold and chilly feeling. Let's please unmute, doctor. Not responding. Okay. If anybody would like to participate, please raise your hand. The most important thing is that this mathematics background. So two things must understand, I think. One is this diet regimen. Then second one is this anti-mathematic medicines. Then of course the change of potency is the repetition, the attenuation, the dose. All these things are very important as far as homeopathy is concerned.
Yes, sir. It is definitely important.
Yes, yes. Some of the vegetable acids like the buttermilk, then the lemonade, this should be avoided. Then spices and condiments must also altogether avoided. So a thorough reading through this the chronic disease, the latter part, last part, a lot of instructions are given regarding diet and regimen. But unfortunately, majority are not bothering about this. Yes, Dr. Umesh.
Yes.
Any comments, please?
Very nice presentation.
Thank you.
Your senior fellows, you can have add something. Dr. Ramadevi Ambadi, are you there? Responding. Maybe in busy practice. In which did you complete your course there? Postgraduate course?
No, sir. Oh, 2 months are left.
Which subject you are doing this PG?
Pediatrics.
Yes, that's good. Yes, Dr. Brit Gopal. Please unmute. Yes, you can unmute now. Dr. Brit Gopal. Responding. Dr. Ramadevi Ambadi, please. Dr. Ramadevi Ambadi, you can unmute now. Maybe network problems, maybe. Dr. Sharma, Dr. YC Sharma, you can unmute now. क्या करेगा ना करेगा. Dr. YC Sharma, please unmute now. Maybe some technical problems.
Maybe.
Yes, that is the major obstacle to this. Fortunately, it was today much lesser than what happens. I think more studies are needed and more publications are needed in these cases. Moreover, only a few limited number of persons using homeopathy, because we are not at all publishing to this public domain, as well as we have to develop the institutions. What the common man is needed, big institutions, otherwise they will not accept it. They will not believe it. They are prejudiced. Dr. Sharma, please. Yes.
This is a very good platform for researchers, I feel.
Yes, definitely. Moreover, we are connecting the physicians all over the world.
Yes.
Different continents.
And now is the time for research-based homeopathy. And no one will believe us if we are not promoting it, if we are not doing researches on our level, and if we are not even if we are doing, we are not publishing it. And how will the world know what we are doing, what we are capable of, if we are not publishing it? If it is not evident enough, if it is not there out for the world, how will we know about it? So it is very much needed that more and more researches in the field of homeopathy are done, and more and more people publish what they have done.
Yes, that is more important. Moreover, I think what I just mentioned is that we need institutions. Our Dr. Prakash Rao is conducting a lot of studies in the JIPMER Pondicherry. But unfortunately, the majority of our brethren or this doctors not at all aware what is going there. Hundreds of publications are there. Central Council of Publishing. A lot of magazines are there, but nobody is reading this. That's what often happens. Then, of course, we know the in fact what happens. What is the reality behind all these researches, the so-called researches? They successfully researched or conducted on these COVID vaccines. Then what happened? They administered the vaccine. Then what happened? But nobody is there to question it. So when we talking about the research, this up to a certain extent it is valid. You know, recently a paper was research was done and it was awarded Nobel Prize. Later it was withdrawn by this scientist because of the wrong assumptions she made. So often it happens directly proportional to the investment, not the facts. Then this last day, Dr. Venugopal Reddy mentioned about you don't think that the statistics will always bring the facts. He gave an example. The alcoholic causing this road traffic accidents in 20% of cases. Then he said that That means the remaining 80% are caused by the non-alcoholic beverages. So which is the major one? So in this way, the study is always going. So we cannot totally depend upon this, the so-called researchers. That's why I always strongly suggesting that we must have the entrepreneurship. We should have the enough the institutions, including the national institutes as well as the international institutes. Now, Dr. Hariharan sir, please unmute.
Okay, Dr. Rajan, I have not heard completely your narration, but my opinion is that if a PICA patient comes to our clinic, we must undergo thorough checkup, blood group examinations, and find out which deficiency is caused by that patient. That may be phosphorus, that may be so many minerals of sodium, or those items we must know, and we must link it with the patient symptom and give the exact news. That is the best way. Say in our repertory, in my opinion, that in our materia medica portion, the PICA is not complete. So scientifically, we must approach to that symptom. See, last time the doctor presented a case of migraine. But then I have also such an experience. Several homeopathic medicines I also give, but it is not getting relief. That time I examine the blood and find out that that patient is having severe anemia. So I gave the Fermet along with Fermet 200 along with the Fermet 3x and the antisoric remedy. So completely the migraine vanished and the patient is cured. So if a PICA patient come to us, I don't know, the pronunciation is different. Certain fellows say PICA, certain doctors say PICA. Anyway, I will say PICA. That it is you must go through the exact blood report, then find out actual deficiency and give that deficiency medicine of either homeopathic, or even if you want to go give the vitamins, you must give the vitamins. So the PICA will be banished. So we must, my opinion is that we must have scientific approach. Okay, thank you very much.
Just mentioned aphorism 5, exciting cause, maintaining cause, and fundamental cause. These are the duties of physician to examine, see what went wrong, what could be wrong. Then also give the medicine. So definitely that will cure. Dr. Sharma, are you there? Please unmute now. Dr. Sharma, you raise a hand. Maybe some technical problem. It was accidentally happened.
Maybe, sir.
Yes. Dr. Meenakshi Sharma, do you have any comments? I think you just joined, Dr. Meenakshi.
Nice. Very nice.
Yes, please. Dr. Brikam Bihari. Yes.
Yeah, sir. Oh, yeah.
You raise the hand. Then, Dr. Deepti, you must remember to adjust the time. It's an important thing when you are approaching the seminar or these conferences. Especially when you have become teacher, you should always be cautious about how to adjust. Then we should have enough resources to add something, to cut
Yes,
short
sir.
the time, to increase the time. So that is the success of a teacher. So that must unfortunately lacking because of the reading, deficient reading, especially professional courses. In the earlier there was a custom of this wide reading, but now what is happening is limited for only for giving for writing the answer for the exams. That may be made a mistake from the part of the young generation. So that should be, we should must pay attention to that. Anyway, trying to wind up session, may invite Dr. Ram Parvesh Shah to express a lot of thanks. Are you there, sir? Dr. Ram Parvesh Shah? Yes, please, sir. He's a regular participant of this program, most eligible person. Yes, sir, please unmute.
Thank you.
Yeah,
Uh,
please unmute,
Thank
sir.
you. Doc- Hello.
Yes, audible, please.
Thank you, Doctor. Thank you.
Thank you, sir.
Thank you, Dr. Deepti. Very, very thanks. Behalf of IFPH whole team. Hello.
Sir, I'm unable to hear you, sir.
Okay, anyway, let me complete the formalities. So on behalf of IFPH, I expressing sincere thanks to Dr. DEEPTI Sharma.
Behalf of IFPH, thanks.
Yes. Okay.
Thank you,
Yes.
sir.